Good day. I am Hazel Simindihar,
I am Jeremy Aga.
and today we're going to talk about the Apgar score.
The Apgar score is a scoring system doctors and nurses use to assess newborns 1 minute and 5 minutes after they born. Dr. Virginia Apgar created the system in 1952 and used her name as a mnemonic for each of the 5 categories that a person will score. Since that time, medical professionals across the world have used the scoring system to assess newborn in their first moments of life. Medical professionals use this assessment to quickly relay the status of a newborn's overall condition. Low Apgar scores may indicate the baby needs special care, such as extra help with their breathing.
So, Apgar evaluation of newborn infants. So, these are the categories and how are you going to assess Apgar to the baby. Yeah, you need to use this numberings. 0 in heart rate is absent. The respiratory effort is absent. The muscle tone is limp. Then response to catheter is no response. And color is blue and pale. If 1, heart rate is below 100, respiratory effort slow and irregular, muscle tone, some flexion of extremities, then response to catheter is grimace. Then the color is body pink and extremities blue. Score 2, heart rate is over 100, respiratory effort is good and crying. The muscle tone is active motion. Then response to catheter in nostril is sign of cough or sneeze. Then the color is completely pink.
Why was the Apgar score developed? The score is named for the prominent American anesthesiologist by Dr. Virginia Apgar in 1909 to 1974, who invented the scoring method in 1952. Having assisted thousands of deliveries, Dr. Apgar wished to focus attention on the baby. Babies were traditionally dispatched directly to the nursery, often without much formal scrutiny after delivery. Apgar wanted the baby to be assessed in an organized, meaningful manner by the delivery room personnel. According to Dr. Apgar, was the first woman to be appointed a full professor at Columbia University's College of Physicians and Surgeons.
When is the Apgar scoring done? The Apgar score is done routinely 60 seconds after the birth of the infant, and then is repeated 5 minutes after birth. So, the Apgar is the first test of the baby. In the event of a difficult resuscitation, the Apgar score may be done again at 10, 15, and 20 minutes.
Apgar score. So when 0, the activity or tone is absent. In pulse, absent. In grimace or flex irritability, flexed. In appearance or color is blue or pale. In respiration is absent. In 1, inactivity or tone, some movement. In pulse is 100. In grimace or flex irritability is grimace or slight cry. In appearance or color, it is a body pink or extremities blue. And in respiration, it is slow or irregular. So if the score is 2, the activity or tone is active movement. The pulse is 100. In grimace or flex irritability is active motion or cough, sneeze, vigorous, and vigorous cry. In appearance or color, it is all pink, and in respiration, it is strong or crying. So for the total score of Apgar score, in 7 to 10, it is reassuring. So for the 4 to 6, this is moderately abnormal. So when the score is 0 to 3, this is indicate in slow.
So the 5 signs start with the activity. The muscle tone, A, length flaccid is equal to 0. Some flexing or bending is 1 score, and active motion is 2 score. 2 points for vigorous motion, 1 point for small flexing, and 0 points for no movement seen to the baby.
So the next is the pulse or the heart rate. A is the absent heartbeat is 0, and slow heartbeat or less than 100 beats or minute, this is 1. Inadequate heartbeat 9 more than 100 beats or minutes is 2. So in 2, this is good strong heartbeat. So if 1, this is slow but steady heartbeat. When the heart rate is 0, this is little or no heartbeat.
So grimace or reflexes. Response to stimulation, also called reflex irritability. No response is 0. Grimace or facial expression is 1 score. Vigorous cry or withdrawal is 2 score. 2 points if the baby cries. 1 point if the baby grimace. Then 0 points for no movement or sound.
Next is the appearance or color. Pale or blue is 0, and normal color body, but blue extremities or arms and or legs is 1. The normal color is equal to 0. This is completely pink.
Then the respiration or the respiratory effort. A, not breathing is 0. Weak cry, irregular breathing is 1 point. Strong cry is 2 points. 2 points for a strong cry, 1 point for a slow or weak cry, then 0 points for no cry at all.
What does a high or low Apgar score mean? A perfect Apgar score of 10 means an infant is in the best possible condition. An infant with an Apgar score 0 to 3 needs immediate resuscitation. It is important to note that diligent care of the newborn is an immediate response to the current status of the infant. It is inappropriate to wait until Apgar scores are obtained to begin or continue to address the needs of the neonate.
Low Apgar scores and umbilical artery blood pH predict neonatal death. An Apgar score of 0 to 3 at 5 minutes is uncommon, but it is a better predictor of neonatal death in both term and preterm infants than an umbilical artery pH. The presence of both variables increases the relative risk of neonatal mortality in term and preterm infants. Infants who will fail to initiate respiration, resuscitation, and close observation. So, providing the Apgar test in the baby is much important because it tests the well-being of the baby. So, thank you everyone. Thank you for listening.
Thank you. God bless us all.